Alex, Mrs. Smith just arrived by ambulance. She woke up tonight with severe dyspnea and chest pain. Are you able to help me assess her?
Sure, I'd love to help you.
Hi, my name is Sarah, and this is Alex. We're registered nurses here, and we're going to be looking after you today.
Okay.
Before we go ahead and get started, can I just get you to tell me your name and your date of birth?
My name is Tina Smith. I was born on September 22nd, 1958.
Okay, Tina, can I just verify your armband there? Perfect.
Smith, do you mind if I take your vital signs?
Sure. Do whatever you need to do. I just need to feel better.
Okay.
I can't breathe, so I'd like to.
While she's doing that, is it okay if I just ask you a couple questions just so we can get to know you a little bit better?
Sure.
All right. So just starting off, is there any medications that you're currently taking? Any like over-the-counter products, herbal supplements, or like was there any medications you took tonight before you came in? Aspirin even?
I take Metoprolol for my high blood pressure and
Okay.
Metoprolol for my high cholesterol. Sometimes I forget to take them. I don't think I took them tonight, and I don't take any supplements.
Okay, and what about allergies? Is there any allergies that we should be aware of?
No allergies.
So I just kind of want to get to know a little bit more about the pain that you've been experiencing. Is there anything that you find is making it worse or making it better?
No, it's always there. It's just always there. It feels so awful.
Okay, and is there any particular word that you could maybe use to describe the pain that you're feeling?
It's tight.
Right. And are you able to point to me or for me where the pain is?
So it's on the left side
Okay.
of my chest, but I also feel it on the entire left side.
And on a scale of like 0 to 10, with 0 being no pain at all and 10 being the most severe pain that you've ever felt, how would you say this pain rates?
7.
A 7? Okay. And is there like a particular time when you find that it like flares up or how long it lasts?
Now I went to sleep and it wasn't there, and when I woke up with the chest pain.
Okay, so it's intermittent.
Yeah.
All right, and what do you think might be causing it?
I think I'm having a heart attack.
Oh,
I don't want to
dear.
die.
That's not very good.
Okay, Sarah, her blood pressure is 140/88.
Okay.
Her pulse is 108. Her respirations were 20 breaths per minute. Her O2 stat is 92% on room air.
Okay.
And her temperature is 36.5.
Okay.
So I'm going to go call the doctor and get an order to start an ECG right away, and also get an order for some aspirin and nitroglycerin.
Okay.
Just before I go, I'm going to raise the head of your bed and give you 2 liters of oxygen via nasal prongs. Is that okay?
Okay.
This will help your breathing.
Okay, Mrs. Smith, so you had mentioned earlier that you have high blood pressure and high cholesterol. Are there any other conditions that you are dealing with currently or in the past that we should be aware of?
Yes. So 2 years ago I had a heart attack, and my doctor said that I have coronary artery disease, but I don't know about my family history. I don't really have any family.
Okay. I just have a couple more questions for you, if that's okay. Have you noticed any changes in bowel movements or in your urinary patterns as of late?
Well, I get up 3 to 4 times a night to pee, but everything else is the same.
Okay. And what about your weight? Has it fluctuated at all recently?
Yeah, it's so weird. Like, I have been really checking on my weight, but I seem to gain 2 kilograms in 2 days.
Okay.
Okay, Ms. Smith, so I just need to confirm your full name.
My name is Tina Smith.
And do you have any allergies?
No.
Okay, I just need to take a look at your wristband. Okay. Okay, Sarah, so I confirmed the doctor order for aspirin and nitroglycerin spray. I've updated the MAR. The doctor also ordered an ECG. So I've done, and blood work. He also ordered blood work, a chest radiograph, an echocardiogram, and 4 liters of oxygen via nasal prongs.
Okay.
So I have done my 3 checks of the 8 rights and my allergy assessment and my dosage calculations. So this is the aspirin. This is so that your blood doesn't stick together. So I just need you to chew it and swallow it. You may feel some upset stomach from this medication.
While you're doing that, I'm just gonna go ahead and put these on your chest, and it's just so that we can monitor your heart, okay?
Okay.
So the doctor also wants me to use this nitroglycerin spray. This will help you with your chest pain. Well, by opening up your arteries, the arteries in your heart, to let the blood go through. So I can spray this once every 5 minutes, up to 3 times, and it should relieve your chest pain. Okay? So shh. Just lift your tongue. Shh. Okay, so you may feel some dizziness with this medication. Please try to stay in bed. If you need anything, use your call bell and call us for help, okay?
Okay.
I'm just gonna go ahead and update the data that we collected earlier, and hopefully we can get the doctor and see you soon. Okay, Mrs. Smith?
Okay, thank you.
You're welcome.
Hi, my name is Moushumi, and I'm going to be the registered nurse that's going to do your physical assessment today. Can you please confirm your name? And I'm just going to look at your armband while you say it.
My name is Tina Smith.
Okay, that's perfect. And can you please confirm the date with me and where you are right now?
Today is October 29, 2018, and I'm at the hospital.
Okay, perfect. So I'm going to just use my pen light to just look at it in your eye. I'm just going to flash the light. And can you also follow the pen with your eyes? Okay, that's good. Now I'm going to look at your throat and your chest while Alex is going to help me look at your arms and legs, okay? We may need to uncover and touch some parts of your body. Is that okay with you?
Yes.
Okay. So I'm just going to put this here. And I'm just going to uncover so I can assess it better. Thank you. Alex, I'm noticing that there's no cyanosis or pallor, there's no tracheal deviation, and I'm also noticing that there's no use of accessory muscles. I'm also seeing there's no jugular distension, and her thorax looks symmetrical on both sides. So this just means that your chest looks symmetrical on both sides. It's rising and going down symmetrically. And I'm also noticing that you are reacting with your eyes in a healthy way, and your throat, skin, and neck looks normal. I'm going to go ahead now and just feel a little bit for tenderness or bumps in your chest. If you feel any uncomfortable, anything that feels uncomfortable to you, just let me know, okay?
Okay.
Okay. Alrighty, just gonna make a note. Now I'm gonna go ahead and look at your lungs and your heart with my stethoscope, okay?
Okay.
So Alex, I'm hearing extra S3 sounds on the aortic valve, and I'm also seeing that there's no murmurs, but there's a rhythm irregularity, okay? So your heart is beating really fast and strong, and I can hear some extra beats, okay?
Okay.
All distal pulses were present, and capillary refill is less than 3 seconds. There is bilateral edema in the legs. This could mean that the blood is just having a hard time making its way back up to your heart.
I'm also just going to ask you to take a deep breath. I'm just going to listen to your lungs. Again. Okay. Just going to make a note. So I'm hearing some crackles on both sides of the lungs, and this might just mean that you have some building up of fluids. So what Alex is going to do is she's going to go and notify the doctor. Okay, and in the meantime, is there anything else I can help you with?
What's wrong with me? Am I going to die?
I know it's a very frustrating time for you, and you're not feeling that great. Is there anything else I can do for you? Maybe get you a warm blanket to make you feel more comfortable?
Yeah, maybe that might make me feel better.
Yeah, sure, I can get that for you, okay?
Okay.
Okay, so Mrs. Smith's ECG results came back, and there's no indication of a myocardial infarction.
All right, her blood work also came back. She has her cardio-specific troponin T is 0.09 micrograms per liter. Her cardiac-specific troponin I is 0.31 micrograms per liter. Her total creatine kinases are 100 units per liter. Her CKMB is 5%, myoglobin is 2.2 nanomoles per liter, and her white blood cell count is 8. Her serum chemistries don't show renal failure or any thyroid dysfunction. and all of her electrolytes are within normal range. So none of those values indicate a myocardial infarction. They're all within normal range. She does have her B-type natriuretic protein at 520 picograms per milliliter, which is a little bit high, and could indicate shortness of breath secondary to heart failure. And when we looked at her chest x-ray, it shows pulmonary edema and congestion and enlargement of the heart. So the doctor is suspecting left-sided heart failure right now.
That's what I thought too. The doctor ordered ramipril for vasodilation and Lasix to promote sodium chloride and water excretion. I'm about to prepare those meds now. He also wants us to monitor fluid intake and output and to limit fluids to 1,500 mils per day.
Okay, sounds good.
Okay, so I've just documented on the MAR, and I'm going to go back to Mrs. Smith's room to explain to her what's going on. If you want to come with me.
Yeah, sounds good.
Hi, Mrs. Smith. My name's Brittney, and this is Shannon.
Hi.
We're registered nurses. So the doctor's told you that he diagnosed you with left-sided heart failure, and you've been given some medication to treat that. What that means is that your heart isn't able to effectively pump blood to the rest of your body because the muscle has been damaged. And that might be because of your previous heart attack. And also your heart isn't able to stretch properly or relax, so it's having a hard time filling with blood. And that may be due to your coronary artery disease and your hypertension. Managing these conditions is very important. You mentioned before that you sometimes forget to take your medications. So maybe you could arrange with your pharmacy to put your pills into pre-filled blister packs, because you need to take these medications to maintain your health.
Are you okay?
Hi doctor, this is Shannon calling regarding Mrs. Smith, a 60-year-old female. The patient's experiencing severe dyspnea. She has a history of coronary artery disease, hypertension, and a myocardial infarction 2 years ago. She has been diagnosed with left-sided heart failure while here in the emergency room. Her current vitals are 35.9 for her temperature. Her pulse is 122 beats per minute. Her respiratory rate is 32 breaths per minute. Her blood pressure is 156/95. Her oxygen saturation is 88% on 4 liters of O2 via nasal prong. The patient is coughing, blood-tinged sputum. There's crackles and wheezes presently that we can see bilateral. Accessory muscles are being used. Cyanosis and pallor are noted. The patient's extremely anxious. My recommendation is to increase O2 to 6 liters and prescribe IV morphine sulfate to improve gas exchange. Also, I think we should prescribe dobutamine to improve ejection fraction. I believe the patient needs to be reassessed by you. Stat. Hi, Mrs. Smith. As the doctor already came in and talked to you a little bit about things, you seem to be stabilizing. Your vital signs are becoming more stable. It's been a couple of hours now, and you're breathing a little more easily. As the doctor said to you, your situation has become a little bit more complicated. You have acute decompensating heart failure, as he told you. So basically what this means is that you have tiny sacs in your lungs called alveoli. They generally are filled with air, and now they are filled with blood and with fluids. So the doctor's giving you Lasix or a diuretic in order to help flush out the extra fluid that's building up. But you also will have some swelling in your legs, as you've seen, which is why we've raised the feet of your bed up to try and help relieve some of the discomfort caused by that swelling. So because of the diuretic that you're taking, it can be common that sometimes you can have your potassium levels get lower. The doctor looked at your blood work and recognized that there was some lower levels of potassium. So he's going to come in and talk to you about it, but I'm going to talk to him about potentially prescribing some potassium chloride or something along those lines, okay?
Hi, Mrs. Smith. So the doctor's preparing to discharge you, so we're going to talk about some goals going forward.
Okay. I really want to do everything I can to keep my heart healthy and stop this from happening again.
We really want that for you as well. So we just want to give you a couple different recommendations to help with that. So a couple different things. One, you should definitely avoid drinking alcohol as well as smoking tobacco.
Okay.
Another thing, I know exercise is important, but we want to avoid anything too strenuous. And as far as stress levels go, just try to ease your way back into everything and keep your stress levels as low as possible.
Okay.
You can reduce the swelling that you're feeling in your legs by avoiding salt in your diet, but be careful of salt substitutes because a lot of them contain potassium, and because you're already on a potassium supplement, that can make your potassium levels too high. The doctor is also recommending that you restrict your fluids to 1,500 milliliters per day.
Okay.
So if any of the symptoms that brought you in here return, you need to come back immediately. And I also would recommend that you weigh yourself daily and come back if you gain more than 2 kilograms in 2 to 5 days. And as I mentioned earlier, it's really important that you take your medication as the doctor prescribed.
Okay. I'm going to talk to my pharmacist about the blister pack you mentioned.
Oh, that's great.
And here's your discharge papers. Your appointments are listed there with your physician and the cardiac rehabilitation team. Make sure that you attend those appointments, okay?
Okay. No,
Do you have any questions for me before we leave?
no, I understand everything you taught me. I really appreciate your help. Thank you so much.
Best of luck to you, Mrs. Smith.
Thank you. Bye.